A study of 1,200 patients by researchers at Henry Ford Hospital's Vaticuti Urology Institute found robot assisted partial nephrectomy can preserve kidney function in patients with chronic kidney disease. Senior author and Henry Ford Hospital urologist Craig Rogers.
Now, the implications here are that these patients with poor kidney function used to have to undergo a big open surgery to do this kidney sparing approach. Now, this shows or gives evidence that these patients can also benefit from a minimally invasive robotic partial nephrectomy that we offer our patients here at Henry Ford Hospital.